the Medical Board's Interested Parties meeting on the Physician Health and Wellness Program. Public comments will be welcome following the opening comments by Ms. Torres and Dr. Yip. To be ready for public comment, we ask you to please ensure your comments can be heard clearly by being connected to the audio of this meeting through the proper method. If you are having difficulty hearing the audio of this meeting, it could be because the device you're connecting with has bandwidth limitations. If you do have difficulty hearing the audio of this meeting using your device, please click the ellipsis button at the bottom of the WebEx application or the audio and video menu item at the top of the WebEx application, and then select Switch Audio. You will see an option to call in and will be provided with a telephone number, access code, and attendee ID that can be used to connect to the meeting audio via phone. Using the information provided, it will automatically disconnect your device's audio and connect your phone to the name you joined the meeting with. By using this method, if you're having audio problems with your device, this will still allow you to participate and hear the audio of the interested parties meeting. Please see the instructions on how to connect link on the last page of the meeting agenda for step-by-step WebEx instructions, including screenshots. Thank you, Ms. Torres. Ms. Torres and Dr. Yip, you can now start the meeting.
Thank you. My name is Marina Torres, and I am a public member of the board. We want to thank everyone for joining us today for this interested parties meeting to receive the public's feedback on the draft legislation for the Physician Health and Wellness Program, also known as a PHWP.
Good afternoon. Good afternoon. I'm Dr. Felix, a physician member of the board, and I'm looking forward to today's discussion and feedback. Many of you are aware that the board have been working on regulation to establish a physician health program in California over the last several years. The board published proposed regulations September 2023 for public comment, and after receiving overwhelmingly negative comments from numerous stakeholders, the board decided to examine the legislation establishing the framework for the Physician Health and Wellness Program. At the May 2024 board meeting, we heard from subject matter experts, Dr. Christopher Bundy and Dr. Paul Early, on the best practice for the physician health programs. Following a robust discussion and consideration of public comments, the board made the determination that the existing statutes authorizing the PHWP in California would not allow us to create programs that would meet the best practice for the physician health programs. Consequently, the board voted to not proceed with the regulation on the PHWP and instead asked staff to draft a legislative proposal for a PHWP that would meet the best practice.
The board's primary mission is consumer protection. A well-functioning physician health program will play an important role in protecting consumers by providing early intervention, treatment, and monitoring to physicians and other healthcare providers who may have a physical or mental health condition that could impair their ability to practice in a safe, competent, and professional manner. Given the board's negative history with the prior diversion program that ended in 2008, we are sensitive to the fact that we will have to develop a physician health and wellness program that is appropriately funded, staffed, and accountable to ensure that it is treating and monitoring participants appropriately and communicating with the board when required so that the public is protected. We also want to create a program that the healthcare community will actually use. We want a program that physicians will refer their colleagues to when they need help. We want physicians and other providers who are suffering from potentially impairing conditions to know that they can self-refer to this program to get the confidential help they need to improve their health and be safe to practice. We will now move on to agenda item 2 for public comments.
We're looking forward to receiving public comment, and we ask that you please keep your comments on the topic of the legislative proposal for the Physician Health and Wellness Program, including any suggestion on funding options. As a reminder, the proposed text is posted on the board website under the materials for this meeting, so please keep your comment to 3 minutes or less. Sean?
Thank you, Dr. Yip. If you'd like to make a public comment, we've activated the hand-raising feature in WebEx and also the Q&A window. If you can't find the hand-raising button, just please type you'd like to make a public comment or your name. No need to type the entire question in the Q&A window, but we can call on you that way. And also, if you're on a call-in only line, which I don't see any at the moment, but I'll probably repeat this a few times just in case, you can press *3 in order to toggle raising your hand on a call-in only line. So we'll call on you in the order that we see you raise your hand in there. First up here, and I will be giving a audio prompt when you have 30 seconds remaining of your 3 minutes too, just to, don't mean to distract anyone while they're making their public comment, just to give you an idea of where you're at in the timing. Thank you. So first up here, we have Taisha Watts. Taisha, you should be receiving a prompt on your end. Good afternoon, Taisha. Please go ahead. We hear you. Oh, try one more time here, Taisha. Let me send you that request. We heard you the first time. I apologize for talking over you.
Sorry. Okay. My name is Taisha Watts, and I'm here on behalf of the California Academy of Family Physicians. Thank you for the opportunity to discuss a crucial issue impacting our healthcare providers' physician wellness. As CFP, one of our top priorities is eliminating physician burnout, supporting family physicians' wellness and joy in medicine. Family physicians provide comprehensive whole person care across the lifespan from birth to end of life, addressing both the physical and emotional needs of patients. As a result, their role is especially demanding, and their well-being is critical to maintaining the high standard of care patients deserve. Long before the COVID-19 pandemic, burnout, depression, even physician suicide were significant issues within our healthcare system. These challenges have only been exacerbated by the pandemic and ongoing physician workforce shortages. Family physicians bear a particularly heavy administrative burden while delivering continuous whole person care. It is more important than ever that we prioritize their well-being. We are encouraged by the establishment of the Physician Wellness Program, which is essential to step forward in breaking down the stigma surrounding mental and behavioral health support. Too often, physicians are deferred from seeking help due to fear of retaliation or losing their licensure. This program is a powerful tool in combating those fears. However, we believe there is more work to be done. We urge the medical board to ensure that the program goes beyond addressing impairment or potential impairments. It should actively promote a culture where all healthcare providers feel safe seeking treatment for physical, mental health, or substance use disorders without fear of retribution. Physicians need to know they can seek help and continue to practice in their specialty without jeopardizing their careers. Furthermore, believe it is critical that the voices of those this program is designed to serve, our physicians, are represented in its development. Today's open forum is a positive step, and we hope this collaboration approach continues. We look forward to working alongside the medical board to break down barriers to mental and behavioral health treatment for physicians. Together, we can create a healthcare system that supports the well-being of those who dedicate their lives to caring for others. Thank you for your time and consideration.
Thank you very much for your public comment. Let's see, next here we have Edwin Kim. Edwin, you should be receiving that prompt on your end. Good afternoon, Edwin. Looks like your line's open.
Testing.
We can hear you, Edwin. Please go ahead.
Excellent. Hi, my name is Dr. Edwin Kim. On behalf of the Federation of State Physician Health Programs, we extend our gratitude for the board's dedication and hard work in advancing the needs of California's public by forging a pathway for physicians and trainees to safely address health matters. We look forward to the day when California can join the other 47 states that have an authorized PHP program that meets the FSPHP PHP guidelines. PHPs have a 50-year track record of serving the health profession and ensuring public safety. We offer our statement today enthusiastically as an introduction to our written comments, which will follow. Our review confirms that elements of the proposed regulation are aligned with core FSPHP principles. Specifically, this moves California closer to a program supported with the requisite triad of confidentiality, which ensures that a physician or trainee can navigate health concerns in a private, expertly supported manner while also protecting the needs of the public. The board's document reflects thoughtful research into and adoption of model PHP approaches across the country. It includes elements of the FSPHP PHP model, which has a proven record with positive outcomes. Kudos to the committee. We would like to highlight what we view as the board's attention to 1, a structure in which a health and wellness program can independently operate in connecting the physician to expert intervention. 2, clear parameters for those who may need to be reported to the board for further action. 3, a pathway for confidential referrals separate from the medical board when patient safety is not at risk. The proposed framework addresses the essential need for confidential care for physicians while also strengthening the response to individuals who, through an impairment, may temporarily be unfit for duty. Additionally, we acknowledge that this drafted legislative change considers the safeguarding of those who make good faith referrals and reports to the PHWP. All in all, it also provides physicians, trainees, and licensees the ability to come forward and receive confidential care in a health and wellness program. Participants who are compliant with the PHWP program and monitoring agreements and who do not pose a risk to patient safety should not be known to the board unless they are deemed unsafe to practice or pose a danger to themselves or others. To
30
this
seconds for me.
effect, we acknowledge the board's efforts to distinguish three pathways for individuals. One, individuals who participate and are never known to the board. Two, individuals who are referred directly from the medical board to the PHWP. And three, individuals who are referred by the PHWP to the medical board for failure of adhering to program requirements and who, in the opinion of the program, pose a reasonable concern for patient safety. Please refer to FSPHP's written comments for further clarification on our views. We look forward to being available consultatively, and thank you most of all for designing what can become a state-of-the-art physician health program.
Thank you for your public comment. Next up here, I believe we have David Granovetter. David, let me find you here and send you the request. Hopefully you're receiving that prompt on your end.
Can you hear me all right?
We can, David. Please
Yeah,
go ahead.
thank you. Yeah, so my name is David Granovetter. I've been a full-time practicing physician in California for 35 years, the past 22 of which have been in the field of addiction medicine. I've also served as the chair of physician well-being for the Kaiser San Jose Medical Center for the past 20 years, and as the regional chair for the Permanente Medical Group for the past 6 years. However, the comments and opinions I share today are solely my own. As someone in long-term recovery from the disease of addiction and a graduate of California's prior PhD in 2002, and after 5 years of participation, I can unequivocally state my involvement in the PhD saved both my life and my career, provided me with the opportunity to not only continue serving thousands of patients, but also to assist many of my physician colleagues who have been dealing with impairing or potentially impairing conditions. This experience underlines my firm belief in the critical need for a well-designed and effective physician health program in our state. I commend the board's efforts to establish a new PHP and appreciate the thoughtful consideration given to prior expert testimony and comments in shaping the proposed regulatory framework. While the proposed regulations align with many of the best practices in the field, I believe there may be some areas where further clarification and/or enhancements could be made to further strengthen the program and its long-term success. I'll mention a few of them here and in a subsequent written statement. I'd encourage the board to consider incorporating more proactive outreach and education around early intervention, fostering a culture where physicians feel empowered to seek help before any official reporting is ever necessary. I would suggest incorporating a system of graduated responses before formal reporting takes place, and this approach allows for additional remedial measures such as intensified monitoring. I would applaud the proposed regulations regarding safeguarding confidentiality, particularly for voluntary participants. However, I'd urge the board to carefully consider any potential loopholes that might inadvertently erode these protections, such as unnecessary reporting where physicians are actively complying with the program. And I believe it's essential to include more detailed language specifying how the monitoring component will be sustainably funded. Successful PHPs in other states have demonstrated that dedicated and transparent funding models are crucial for the long-term sustainability of the monitoring process. So in closing, I wish to express my deep gratitude for the board's commitment to establishing a physician health and wellness program that reflects the highest standards of care and professionalism. And I look forward to continuing to support the board's work and the future of physician well-being in California. Thank you.
Thank you very much for your public comment. For anyone who joined late, you can put yourself in the queue to make a public comment by either using the hand raising feature in WebEx or just typing anything into the Q&A window. We'll call on you in the order that we see it. If you're on a call-in only line, I see one now, you can press *3 in order to toggle your hand on a call-in only line. So next up here we have Black Patients Matter. You should be receiving that prompt on your end.
Yes, hello. So this is Hannah Ree with Black Patients Matter, and we are very appreciative of the opportunity to talk with you and to bring up an issue that appears quite often when it comes to healthcare, and that being the care and well-being of minority physicians, especially those that exclusively or for the majority treat patients from an underrepresented minority background. And so we are just asking the board, in this case with the Physicians Wellness Program, that whatever experts, quote unquote experts, or people in power who determine the disciplining or the rehabilitating of our physicians, that we ask that they have, I mean, it's just so obvious now, but apparently it's not the case, but we ask that they have on their resume submitted to the medical board, if they call themselves an expert, especially if they're being paid by the state of California, by the medical board, and they claim to be an expert on the field of addiction medicine, the field of psychiatry, we ask again that they have on their resume significant work and school history, which reflects the fact that they have treated patients of a diverse background. What we have found with the medical board is that, unfortunately, and I don't know why this is the case and why it wasn't caught before the year 2024, but the majority of physicians who are experts for the state of California have absolutely no training or any kind of work or publications, which reflects the fact that they have worked with a diversified patient population. And so why is that? I guess it's not important to the medical board that they have experts, or they just assume they are not needed, or that treating only white patients is enough. So we ask the medical board to please address this issue, this lack of medical experts who have a background as reflected on their resume on file, that they treat a diversified patient population. And so we thank you for this opportunity. Thank you, Jesus.
Thank you for your public comment. Next up here we have David Kahn. Maybe? Sorry, David, are you there?
Dr. David Kahn, and I'm an addiction psychiatrist. I performed evaluations of the Medical Board of California, and I also treat physicians in my practice. I'm here representing the California Society of Addiction Medicine, CSAM for short. I'm a past president of CSAM and a former chair of the Physician Wellbeing Committee. CSAM is a medical specialty society of over 600 physician leaders and addiction experts in California. Over the years, CSAM has consistently advocated for a physician health program that aligns with the clinical experience and takes advantage of the experience amassed by programs in other states, and we applaud the board's effort in that new direction. We believe that a properly structured and administered statewide physician health and wellness program can make the Medical Board of California far more efficient and effective in its mission in protecting patient safety. We know that bringing a physician to PHWP with early identification and early intervention will make a huge difference. We support the voluntary evaluation, treatment, and monitoring provision that allows the board to refer a licensee to the program if the investigation finds that the conduct may be the result of an impairing or potentially impairing condition. We support the requirement that persons carrying out roles in the program have experience in the treatment of healthcare professionals with impairing or potentially impairing conditions, because we know that there are unique aspects to the intervention and treatment of any specific group, and particularly of medical professionals. In addition to our support for the program as you envision it, we have several serious concerns about elements of the proposed language. We're concerned about quote-unquote program violations, and we want to see the language mirror the recognized guidelines for how instances of non-compliance, not violation, will be evaluated and handled. We will continue to follow the development of the proposed legislation and submit comments to support a program that will attract the greatest number of physicians who could benefit from it. Thank you for pushing this effort forward.
Thank you for your public comment. Next here we have Karen Mioto. Karen, you should be receiving that prompt on your side.
Can you hear me?
We can, Karen.
Yeah, my name is Dr. Karen Miotto, and I'm the chair of the UCLA Medical Staff Physician Health Committee. I'm a member of the board of California Public Protection and Physician Health. I'm also an active member of the Federation of State Physician Health Programs. I'm here today to speak for CP3H, which is a nonprofit organization, and we've been dedicated to patient safety by supporting medical staff and medical groups as they carry out their responsibility and their role in identifying, referring, and monitoring physicians with potentially impairing conditions. We are so eager for a effective physician health and wellness program, and I can tell you that from well-being committee chairs, evaluators, and other professionals who interact with physicians. And so we really want to advocate for a robust, clinically effective, evidence-based program. And we just so appreciate and applaud the medical board's effort in this direction right now. Coming from a large academic medical center, I can tell you the importance of involving medical students, residents, and fellows. And so also just want to commend those elements in your program. For one, CP3H does have concerns, and we're happy to put those in detailed in writing for your consideration. One of the concerns is about the advisory committee. It appears that the advisory committee will be making clinical decisions. And we maintain that the administering entity with the medical director, that's their role. And we just want to echo what you're saying about the importance of funding, and we appreciate your asking for comments about funding, because CP3H means that it just maintains sufficient, stable funding is what's going to protect the public. And so for the other elements, we appreciate the opportunity and we'll submit written comments for your consideration as we move forward with this really promising approach. So thank you.
Thank you for your public comment. Anyone who maybe joined late and didn't hear the instructions, you can raise your hand by using the hand raising feature there and queue up for a public comment by using the hand raising feature there in WebEx, or you can just type anything, I'd like to make a public comment, or just anything in the Q&A window. We'll call on you in the order that we see it. If you're on a call-in only line, you can press *3. Next up here, we have Lucas Evanson. Lucas, you should be receiving that prompt on your end.
Can you hear me?
We can. Please go ahead.
Okay, great. Hello, my name is Lucas Evanson, and I'm speaking on behalf of the California Medical Association. CMA would like to first thank the board for embarking on this effort. The language released for discussion reflects a sea change. What we see is a proposal that recognizes that impairment is not a personal failing, that seeks to provide meaningful ways for licensees of the medical board to access help in the furtherance of consumer protection. We are very pleased to see provisions to allow for confidentiality of participants who have come to the program voluntarily and that provide confidentiality of records, which aligns with existing protections for confidentiality of medical information. We are also pleased to see a mechanism to allow for referral by the board to the program in lieu of discipline when there has been no patient harm. The language is very comprehensive, which we again appreciate. We will need additional time to fully analyze and provide detailed feedback. There are a couple high-level considerations we'd like to call out. Recognizing the significant costs associated with the program, we would like to suggest that the language include flexible authority to allow for subsidization of the costs to participants if funds are identified and allocated to allow for that. Additionally, the proposed language introduces a new statutory mandatory reporting requirement that warrants further internal review. While physicians are already familiar with their ethical duty as articulated by the AMA to intervene when a colleague's impairment endangers patient safety, establishing a statutory requirement raises questions that should be thoughtfully considered to maintain the balance between professional responsibility and clinical judgment. CMA looks forward to providing additional feedback after having the opportunity to have done that review. We ask that the discussion continue and support continued development of the legislative proposal. Again, we appreciate the language we're discussing today incorporates concepts from the national best practices, and we look forward to continuing to work with the board on the details of the proposal. Thank you.
Thank you for your public comment. Next up here we have Jeffrey. Jeffrey, you should be receiving a prompt on your end. Good afternoon, Jeffrey.
Yes. My name is Jeffrey Brooks. I'm a physician, a California licensed physician with long-term sobriety that was made possible largely for me through the previous diversion program that was in existence before 2008, for which I'm eternally grateful. I understand the board's mission to protect the public. I would submit to you that having a diversion program similar to what existed before 2008 would not degrade that system, but would add to it by encouraging physicians, not discouraging, as is currently the case, for self-reporting and seeking care, seeking treatment. Additionally, the current system requires 2, 3, 4 years at times, in cases that I'm personally aware of physicians who are come to the attention of the board, for the board to act upon, that report, and that time delay just makes it more dangerous for the public, not less dangerous. And having a diversion program where physicians could enter and more quickly be restored, to a position of sobriety and be able to practice in a safe manner would fulfill that mission statement far better than the current system does. Thank you.
Thank you for your public comment. If anyone else would like to make a public comment, you can do so by using the hand raising feature or by typing anything into the Q&A window. You don't have to type your full question again, just that you'd like to make a public comment. And if you're in a call-in only line, you can press *3. We have a request here for Dr. Menner. Dr. Menner, you should be receiving a prompt on your end.
This is Dr. Christina Menor, and I'm an anesthesiologist. I'm also representing the California Society of Anesthesiologists. I'm their president-elect. And I do want to speak in favor of, advancing language for this program and hopefully consistent with the Federation standards. I know that, I think moving forward with the program, like the board has planned is a better route versus trying to establish something under the current legislative language that exists in statute. So I think that you know, we want to be definitely active participants, just like the addiction specialists that spoke earlier. We are experts in substance use disorder and you know, all opioids, fentanyl, all of those types of things. And so we definitely will be part of the discussion. The other things we just want to make sure for our physicians, like was also stated, is that, you know, we have early action and interventions. And something else that's very concerning is that doesn't exist a lot is to have late career guideline services, those types of things. So I do want to speak in favor of moving forward with this and possibly new legislative language for a bill, and willing and able to help with this endeavor. And I thank the board for this consideration.
Thank you very much for your public comment. That takes us to the end of the queue here. I'll do one more call out in case anyone's interested in making a public comment. You can do so by using the hand raising feature. Here we go, Michelle Montserrat Ramos. You should be receiving that prompt. Good afternoon, Michelle.
I'm Michelle Montserrat Ramos, and I'm with Consumer Watchdog. I do not support any type of program that does not include the uniform standards which California law requires you to follow. Do not support overturning 2 laws to protect substance abusing physicians and removing the consumer protection tools that SB 1441 requires of you, eliminating all patient safety. You state the Physician Health and Wellness Program shall mean the confidential resource operated by the administering entity for licensees, applicants, and students suffering from apparent health conditions. Please just tell Californians exactly what it is so anyone outside this board will understand what you are talking about. You want to bring back a confidential program where substance abusing doctors and substance abusing medical students and mentally ill doctors can enter this program without the public or the patients having any knowledge of such. They'll be able to avoid any administrative and legal discipline, and when they fail any aspect of this program or commit minor or major violations, the board will not investigate those violations or failures. There will be no discipline associated with those failures or violations, and the public will never know about them because the board has chosen to give up the tools that our legislators have given them through SB 1441 and has chosen to not investigate these matters and not protect the welfare of these substance abusing doctors and their patients and all Californians. Why refer to anyone as a voluntary participant since you're including doctors referred by the medical board in lieu of the board pursuing disciplinary action as a voluntary participant? You state that you're going to receive and assess reports of suspected impairment from any source. So those impaired doctors that are participating on patients in the hospital and the OR while impaired, you are assessing the reports but not reporting them to the medical board. Intervening in cases of verified impairment means what? Refer them to the board from discipline? How are you attempting to protect the public? Upon reasonable cause, refer suspected or verified impaired physicians for evaluation, treatment, and or monitoring. You do realize that the Uniform Standards already does this and also protects the substance abusing doctor and their patients by giving you the tool of a cease practice order. Why are you eliminating the tools that will already take care of this? The program is going to advocate on behalf of substance abusing and mentally ill doctors to the board to allow them to advocate, to participate in the program as an alternative to board disciplinary action. Who's advocating on behalf of the patients and the public? Offer guidance on participants' fitness for duty with workplaces when appropriate. Are you saying that the program will intervene with hospitals choosing to terminate hospital privileges or submit hospital disciplinary actions? If they are in this program and receiving treatment and their program is effective, why would the program need to intervene with the doctor's employers? I do not support this legislative proposal. I will only support a proposal that does not jeopardize patients' lives, and this proposal does. Thank you.
Thank you very much for your public comment. Next here we have Dylan Elliott. Dylan, you should be receiving a prompt on your end.
Dylan Elliott on behalf of the California State Association of Psychiatrists. First and foremost, want to thank the board for their consideration of this important issue. CSAP closely aligns itself with the comments made by our colleagues at the California Medical Association. We look forward to continuing this dialogue and again, appreciate the board's considerations. Thank you.
Thank you very much. Okay, then again, take this to the end of the queue here. I'll do one more call out in case anyone believes they have their hand raised. You can make a public comment by raising your hand or just typing anything into that Q&A window. Additionally, if you're in a call and only line and you'd like to toggle raising your hand, you can do it by pressing *3. Give anyone a few extra seconds here. Ms. Torres and Dr. Yip, I'm not seeing any additional requests.
Thank you. And thank you everyone for participating in today's meeting. We will consider the comments from the public when making recommendations to the full board regarding the draft legislation for the Physician Health and Wellness Program.
Thank you all for the comment and the thought about it. And as a reminder, if you wish to provide written comments on the proposed legislation for the board's consideration at the board November 21st, 22nd for a meeting, please submit them by November 1 using the email provided on the agenda for this meeting. And honestly, I'm very excited about this with Ms. Torres, the board, and the member, our staff. This is our priority. We take it very serious. We hear you, and we want to make the best program that will sustain and work. So we're going to work and work and work. And thanks for all joining today. Thank you.
Thanks, everyone.
So meeting adjourned.
Bye-bye.
Thank you, everyone.
Thank you, everyone.